We're gonna give the wild one a shot. Have the order. Meds on the way, but we need bodies.
Yeah.
I called ahead. I got kicked last time.
Right arm, left arm.
Right leg.
Need one more.
Got two more. I'm just here to observe and speak with the patient once he's under control.
Hey, Robbie! Can you help us with Mr. Krakozia?
Nope.
Yeah, right. They're about to hold down the patient and they asked the doctor to help. They asked the attending to help. That never fucking happens. 4 nurses, including the charge nurse, holding down a psych patient. This would not happen. We would have security, we would have techs, we would have CNAs. If this ER is really as busy as they say it is, these 4 nurses would not be available right now, especially the charge nurse. Actually, this charge nurse is taking a lot of liberties in this show. Charge nurses usually are in one spot at the nurse's station and they're stuck there. They're not going all over the ER checking on things. They have to be somewhere where they can easily be found. They're not actually getting in the thick of things, which is their job. They shouldn't. Also, you would never ask the attending to help hold down a patient. They got other things they need to do. Where are the techs? Where are the CNAs? Where's the security?
Let's do this. Donahue right leg, Larry left leg,
Oh,
Kim
yeah.
right arm,
Here
I
we
pull
go.
left arm, Perla takes the head, and our young man here will inject. Clear?
About to
Pull socks.
take down
right
the
here.
psych
Good
patient.
luck.
I am injection to the mid-anterior left.
I am injection. Intramuscular injection. They're gonna take a medication with a needle and stick them somewhere in his thigh. Intramuscular. As opposed to intravenous, IV, IM. Ah.
Okay, Mr. Krakozia, we're here to help you. We're here to help you. Oh, God.
There we go. Oh! Ow! He's peeing on. Look at. Look.
Congrats.
And look who was in charge of the arm that was holding the man's penis to pee on the medical student. The charge nurse! The useless charge nurse who shouldn't have been there in the first place. She wasn't helping. She was in charge of that arm and she let him completely just whip his dick out and spray that poor medical student.
Okay, Midazolam will take him down in a minute. We'll monitor him for 20. After that, the Haldol will have kicked in.
Yeah, he's settling down now.
Do I really need to be here for 20 minutes?
Why? Got a date?
I mean, I'm covered in...
I'm kidding. Thanks for your help. Go get cleaned up.
All right, yeah, so they did it. Someone got really dirty in the process because the charge nurse was not taking care of the arm that she was supposed to be taking care of. Is this realistic? Yes, we have had to inject psych patients in the thigh with medications before. Does it usually require 3-4 nurses? If they're available, yes, of course, we'll take them. But for the most part, if this ER is as busy as they say it is, those nurses will be busy and we would be asking security for help. Have I ever gotten peed on? I don't think I've ever gotten peed on. No, wait, yes I have. What am I talking about? I've never gotten peed on like this.
Another 2 of lorazepam.
For a total of 10.
Well, where?
He's still seizing.
This is the patient that was seizing in the waiting room earlier because they couldn't find a room for him in the ER. You see how the doctor's holding him down to stop him from hurting himself? That's kind of what you want to do when a patient is seizing. You want to make sure they don't move around and hurt themselves. You want to watch out for their head so they're not slamming it on the floor. I wouldn't hold them down too much. You don't necessarily want to keep them still. You kind of still want to let them move around, but just make sure they don't hurt themselves while they're seizing.
Get some blankets on these side rails as a seizure precaution.
Yes, blankets on the side rail as a seizure precaution. Did you hear that? Normally, in a very stocked and well-funded ER, you would have what they call seizure pads that you could strap onto the side rails, again, so the patient doesn't move around and hurt themselves. Because when the rails are up and the patient starts seizing, they could start slamming their heads or their hands or their legs on the side rails and hurt themselves. If you don't have seizure pads, which often happens in ERs, what we do is we take a bunch of blankets and we tape it around the side rails and we kind of MacGyver our seizure pads. It happens all the time. I cannot tell you how many times I have taped blankets onto these side rails to make seizure pads. Sometimes I'll find one seizure pad and I'll have one seizure pad on one side and I'll have taped up blankets on the other side. It looks so bad, but it's effective. Those seizure pads, you only have like 2 for that entire ER normally, and you know, if someone's using it or they go missing, then you gotta do what you can with the blankets. When I was a student nurse on my maternity rotation, we once had to ask a dad and his mom, the grandmother, to leave when we went into the room to check on the new mom and found her sitting on the radiator. Oh my goodness, why was mommy sitting on the radiator? Dad was asleep on the bed, What? And his mom was hanging out in the guest chair. His mom said he worked the night shift. She didn't have an excuse for herself. Okay, ladies and gentlemen, we're gonna repeat this again and again until it is lodged into your teeny tiny little brains. If the mother is giving birth at the hospital, the husband who's there is not allowed to sleep. If the mother who just gave birth isn't sleeping, he's especially not allowed to be sleeping on the hospital bed that the birthing mother should be sleeping on. And bonus, if your husband's mother is also in the room, she's not allowed to be sitting on the only chair that's left that's supposed to be reserved for the birthing mother. I don't give a if you worked the night shift. You could have worked 6 night shifts in a row. Get your ass off the bed.
Don't worry about it, though. I'll talk to my attendant.
Oh my
shit.
God.
I need a little help here!
How is this the second time someone has scored blood
Tonsillectomy
on this
hemorrhage.
kid?
Yank out and sponge stick.
He was stable, then it just opened.
Hold the blood bank. 2 units.
shit.
Hold blood. Get a second line.
This is a terrible situation, okay? Bleeding from that area of your body is almost impossible to fix. What we usually do for a bleed is we'll try to get in there and we'll stitch it up, but because it's so deep down his throat, like there's no way they're gonna go in there and stitch that while he's awake. So the best thing you wanna do is to intubate and stitch him while he's out. But the problem is, if you intubate him, now there's a tube in the way. There's no way you're gonna get to that cut. This is a terrible situation and has never happened in any ER I've worked at. So let's see what they do.
What happened?
A bleeder opened up.
Ketamine on board to intubate.
That's holding at 97.
Can you get an airway?
Almost impossible to intubate this patient because they are bleeding directly out of that area where you're trying to get the intubation tube through. So what are they gonna do?
Okay, hold on. We can try retrograde this patient.
A what?
There's no obstruction. We just can't see what we're doing. So we take a needle and we put it in the cricothyroid. We run the guide wire up and out the mouth. We can slide the ET tube up over the wire.
What did he
Never
say?
seen one before.
So that's 90.
No time to play MacGyver.
What's he gonna do? What did he say? We're gonna try a retrograde intubation. What the fuck is a retrograde intubation? A retrograde intubation is a technique used in a difficult airway management where a guide wire is inserted through a puncture in the cricothyroid membrane, then used to guide an endotracheal tube into the trachea. Are you fucking kidding me?
What's up? Yellow on CO2. That's good.
That is very good.
Shut the fuck
The breath
up!
sounds bilaterally.
Stats coming up.
Okay, so let me try to get this straight. A normal intubation is when they put a tube down the person's mouth, throat, and into the lung. They can't get the tube past the neck because of all the blood and the gauze that's trying to stop the bleeding. So what they did was they poked a hole here at the cricothyroid membrane, put a wire through, and they made it go through the mouth. So now the wire's in 2 places, throat and mouth. They stuck the tube down the patient's mouth using that wire that they stuck through the neck as a guide to get the tube down into the neck as they pulled that wire out, and now the tubes, that is, you can't, you're fucking kidding me. When does that happen? How would not happen? That is crazy! I mean, in what third world country did they practice this shit in to find out that this is possible? This is all still in the same day. All still in the same day. All right, Anthony, I'm gonna start an IV on you. Why? Because the doctor ordered you some medication and I need to start an IV to give it to you. Okay, but please tell me everything you're gonna do before you do it. Of course. First thing I'm gonna do is tie this tourniquet around your arm to get a better look at your veins. Ow, that's really tight! It'll just be for a second. It's too tight, you need to loosen it! Okay, how's that? That's better. Okay, this is gonna be a little cold. I'm gonna clean the area. What's in that? It's just a little soap and disinfectant to clean the area before I put the IV in. Okay, fine. Here we go. Ah! Okay, here comes the needle. Big poke on 3. 1, 2, 3. Ah! Okay, all done. Is that it? Yep, just gotta flush it with a little saline and we can start your meds. Whoa. what's in that? Just some saline, a little salt and water. No, I can't have that. I'm not allowed to have salt. Oh, there's very little salt in here. It shouldn't affect you at all. No, my doctor says I can't have salt because my heart is weak. Plus, it makes my stomach hurt. I'm on a no salt diet. It should be in my chart. Please read it. Anthony, this amount of salt should not affect your heart. If you push that into my veins, it will give me a heart attack. Are you trying to kill me, you dumb mother... 52-year-old male with chief complaint of 8 out of 10 chest pain that radiates to his abdomen. Upon attempt to place patient IV, patient states that he does not want IV to be flushed with normal saline because it contains salt, which will make his abdominal pain worse and give him a heart attack. Attempted to explain to patient that there is minimal salt in saline, to which patient replies, quote, "Are you trying to kill me, you dumb motherfucker?" End quote. MD notified. Ordered a flush with dextrose instead. Patient agrees. No further incident at this time. What's going on today, sir? My dad had knee surgery last week, and now he can't stop peeing. Not to worry, we'll get him checked out. Any pain in his knee? No. Anything else besides the frequent peeing? No. We will need a urine sample from him. I knew you'd say that, so I brought it. Brought what? His urine. Here. It's still warm. Oh. Wow. Okay, give me a second. Do you think it could be a UTI? We'll know more once we get this to the lab. I'll be back. Ugh. Okay, sir, What are you doing? Oh. Is it okay if I use this? 76-year-old male brought in by son for frequent urination and past medical history of left knee surgery. Upon initial assessment, patient's son provides a urine sample in a container that he collected from home. After urine was sent to the lab, patient's son was seen washing the container using the sink in patient's room. Advised patient's son against reusing containers with urine in it, to which son replies, quote, "Why would I throw away a perfectly good container?" End quote. MD notified. Social work consult requested. No further incident at this time.